Hi guys! Today I'm going to talk to you about recognizing a stroke and what to do about it. First of all, what is a stroke? A stroke or cerebrovascular event is any event that causes a blockage to your brain and therefore oxygen and nutrients cannot get in, and it can cause permanent brain damage. Strokes affect thousands of people every year, and over 750,000 people in the United States are affected by stroke each year. It is one of the leading causes of death and disability in the world, and studies show that most people who have a stroke were not aware of their risk factors at the time that they had their event. So let's talk a little bit more about what a stroke is. First of all, there are three main types of stroke to make it easy. One, a TIA, which stands for trans-ischemic attack. Say that 5 times fast. This TIA looks like a stroke, but the symptoms go away within 24 hours. So someone that has a TIA might think they don't need to see their doctor. They would be wrong. This is still very serious. A TIA increases your risk of having a stroke. So if you have a TIA, you can see your doctor and talk about things that you can do to reduce your risk. The second type gets a little more serious. This is, first of all, one of them is called an ischemic stroke. This is the type in which a blood clot blocks the flow of blood and nutrients and oxygen in your brain. This can be reversed or be treated in the hospital if you are seen in a good amount of time soon after the event starts. The other type is a hemorrhagic stroke, in which there is bleeding into your brain, again causing problems with the nutrients and oxygen which are getting to the brain cells. So what can we do about it? I said before, the sooner you get medical attention, the better your outcomes. So we need to recognize it and work fast. So I'm going to give you a handout that you can put on your fridge, and we're going to use the acronym FAST to help us remember what to do when we see someone who's having a stroke. First of all, the F stands for face. The person may experience some numbness or weakness on one side of their face. You could ask them to smile or show you their teeth while you look for unequal facial movements. A second sign, the A, stands for arm. The person may experience weakness or numbness on one side of the body, again in one arm. You can ask them to hold their arms straight out like this, and you can look for one side to drop down like that. So if you see a droop in their arm, that's another sign they could be having a stroke. The S stands for speech. If you notice the person suddenly is having a slurred speech, or they can't quite get out the words, or they're saying words that aren't making any sense, this could be a sign that they are having a stroke. The T stands for time. Simply put, time is brain. We need to get this person to the emergency room as soon as possible. We want you to activate 911, call the operator and tell them what symptoms the person is having, and very importantly, write down the time that the person was last seen normal. This will help the medical professionals determine what type of treatment is best for the type of stroke that they are having. There's no way for us to know what type of stroke we're having until we get to a stroke certified center that does the appropriate imaging testing that tells us what kind of stroke we're having, and then they will determine how to treat it. So our job, if we're at home and we notice someone's having one of these symptoms, is simply to call 911. For you, I want you to know your risk factors. Talk to your primary care provider about your cholesterol. Know these numbers: cholesterol, blood sugar. Take medications to help you keep your blood sugars under control. Make good choices with healthy food choices. Get some exercise. Try to quit smoking if you smoke. Don't start smoking if you don't smoke. And overall, make good choices. Don't use recreational drugs. Eat healthy, stay active. And until next time, stay healthy and happy.